All right. Welcome everybody to today's event on exploring veteran benefits. Excuse me. Today's May 8th, 2024. Just some housekeeping before we move on. I do want to let you know that the chat is going to be shut down. So if you have any questions regarding any of the presentations you guys see today, please put those questions into the Q&A feature. We will use that to facilitate the Q&A at the end of the event. Uh, or we may get to those questions earlier if necessary. I do want to thank Skyline College, City College of San Francisco, and the Student Veterans Health Program for being here today. And I want to give a special thanks to the San Mateo County Veteran Service Office for being here as well and helping us talk about veteran benefits. I'm going to go ahead now and introduce Bridget Leach. She is with the SFVF, or the Student Veterans Health Program, which is part of the SFVF. And she's going to talk to you a little bit about the healthcare system. So, Bridget, if you're ready, go ahead.
Great. Thanks so much, Michael. I really appreciate being here today, and wanted to kind of welcome everyone on behalf of our San Francisco VA Student Veteran Health Program, as well as City College of San Francisco and the Skyline College VRCs, both of which I support. So this is kind of our general kind of starting slide, and we can go to the next slide as we kind of dive into the navigating VA healthcare portion. Thanks so much, Michael and Gianna. So as far as kind of navigating VA healthcare, there's a reason why we have a presentation, such as this, when we're looking at exploring veteran benefits. And I like this quote in particular because I think it really speaks to, the way that this person in particular had asked or had said, that there's this magical world of resources out there, but not really sure exactly how to get there, how to get to them, right? What road to take, what number do I call, what door to walk in. And our San Francisco VA Student Veteran Health Program is really kind of designed to try to help folks navigate that. That's really kind of how we came into being on campuses in the Bay Area. And we really, I think in general at the VA, try to have that there's no wrong door. You can really go walk in whatever door you need to in order to get connected with services. Sometimes that might be the emergency room as a first step to just try to figure out where to get connected, but we'll talk a little bit more about that today. And again, we're always happy to help folks in navigating through the VA healthcare system. Next slide, please. Thank you so much. So as far as this particular slide, we always think it's really helpful to do kind of a bird's eye view of the VA because there are three distinct administrations kind of within the VA, and they oftentimes will get interchanged. So the way that I tend to think about the three branches, there's the Veterans Health Administration, and that's the branch that I work for, and that is really the branch that I think of as involving treatment and care. So really any medical treatment, mental health treatment, specialty services through the healthcare side, that's really what the Veterans Health Administration is looking at. And then kind of moving on to the Veterans Benefits Administration on the opposite side, I tend to think of the VBA as really anything involving benefits and kind of payments. So I tend to think about the monetary side. So for example, things like GI Bill payments, perhaps VRNE if you're connected with that particular section of educational benefits or vocational benefits. Also service connection disability payments as well. So that's how I tend to think about the VBA. And one example that sometimes will happen with us is that I will ask folks if they're enrolled in VA healthcare, and they'll respond with, yes, I have a service connection disability rating, which is actually, a different kind of branch of the VA. So a lot of times they'll get conflated and mixed up or assumed if you're enrolled in one, you're enrolled in the other, which is not necessarily the case. So it's important to know that there are three distinct branches. Also, there's the National Cemetery Administration, although hopefully it'll be many years before you need to worry about that. But it's still good to know that those benefits are there. And while the County Veteran Services offices are not actually it's not a branch of the VA, we work very closely with them. So I started to add to this slide the County Veteran Service Office to really show, and we're really lucky to have Ed here today from the County Veteran Service Office in San Mateo, how the CVSOs really work very closely with us at the Veterans Health Administration, as well as helping folks in processing claims through the Veterans Benefits Administration. They also will do benefits reviews as well, really to help orient veterans to the different benefits that they're eligible for and entitled to as well, and help again with filing claims and disability. And we'll talk also about, as we keep moving along, how they also can impact and influence eligibility for different services and branches as benefits as well. Next slide, please. Thank you so much. So again, kind of with the bird's eye view, even though we're kind of now zooming in a little bit more into the Veterans Health Administration side, it's important to know that the VA healthcare system is a national healthcare system. So once you enroll in VA healthcare, you're enrolling nationally. You really only need to enroll in the VA once, and then what you can do is register in additional VA medical centers across the country. But you usually will, for example, if you initially were in the San Francisco area, got enrolled in the San Francisco VA, that enrollment will happen once. We're really lucky today at City College to have one of our health benefits advisors here to be able to help folks on site after this presentation. But then let's say you move to somewhere in the kind of Palo Alto area, you want to get enrolled or registered in the Palo Alto VA, you can do that. Maybe you move across the country and you're in New York City going to school there, and you want to get registered in the VA healthcare system in kind of the Manhattan or the New York City area. That's also something you can do. But once you're enrolled, which is great. There are also VAs in Guam, American Samoa, Puerto Rico as well as the Philippines. Eligibility is a little bit different for that particular one, but it's good to know that it is across the country. Next slide, please. Thank you so much. So now going a little bit closer into the Bay Area, it's good to know, it's good to really register and enroll in the VA where you're taking classes. So for example, there are kind of folks that are attending City College of San Francisco, Skyline College, other Bay Area schools. It's really good to register in the San Francisco VA if you're taking classes in that city, or San Bruno is actually also part of the San Francisco VA healthcare system area. Because, you know, God forbid something happens, you need to go to the emergency room, you're enrolled in that local kind of VA system. You can still keep your primary care if, like, a lot of times we'll have veterans commuting from great distances, so you can certainly still keep your care in other areas. But it is good to register in the VA and enroll in the VA where you are actually taking classes. And there are also some kind of what I like to refer to as a la carte services that you can receive at the San Francisco VA. And we'll go through those a little bit later, even if you have your care elsewhere as far as your primary care. And this is kind of also a helpful illustration for folks that are in the Bay Area. There's the San Francisco VA healthcare system is really the hub in San Francisco, is where the emergency room is. The Northern California VA healthcare system, their hub is in Sacramento. That's where their emergency room is. Emergency rooms you can go to 24/7. For the Palo Alto VA, their healthcare system is their emergency room is located in the Palo Alto VA, or in Palo Alto, excuse me. Next slide, please. Thank you so much. So I'm not going to go into a ton of detail as far as healthcare eligibility because I added this meme to this particular slide. It's pretty complicated in a lot of ways. So I added the meme to say, see, it's simple, because it can kind of feel, perhaps when you're working within the system for a while, it gets to be a little bit simpler, but at the same time, it can be a bit of a complicated process to figure out if you're eligible. One of the things that's nice about working with student veterans is student veterans are generally eligible because they've usually had 2+ years active duty time and honorable discharge, and their income is usually below the local threshold for eligibility. So for example, if you're living in San Francisco or San Mateo counties, for a single veteran, your 2023 income, if you're applying now in 2024, would need to be below $114,000 $1,510. Oh, okay, let's see here. Can you guys hear me now?
Yeah, you're good, Bridget. We can hear you.
Okay, great. Sounds good. Dennis just came in to let me know that the volume was a little bit off. So thanks so much. Maybe it's specifically at City College, but glad it's working on the webinar side of things. And the thing that's good to know, so there are different factors that are considered, right, for eligibility for VA healthcare, as well as any benefit really across the VA. So things like disability rating is something that may impact, but you don't have to be service connected. Service history, discharge type, income level, those are all kind of pieces, as well as most recently, whether or not you were exposed to toxic, you had any sort of toxic exposures. So that's another thing that we'll talk about, and I'm sure Ed will be talking about as well today. And also it's good to know that the VA continues to open up eligibility to additional veteran groups as well. So it's always good to consult with myself, my team, with our Student Veteran Health Program, or your local VA member services or eligibility or enrollment department. Sometimes they're named different things, but something along those lines. It's also okay to ask for someone to double check. If you received a notification that you were ineligible for VA healthcare and you want to have that double checked, please feel free to ask one of us or to ask to talk to a supervisor if you want to double check that that's true. Or if it's been a year and you know that there's kind of been additional things that may have changed, I think it's really important to know kind of three major things when you're thinking about VA healthcare eligibility. One, you want to know if you're eligible for VA healthcare. Two, you want to know if you're not eligible, why not? And have that double checked. And then the third would be what would need to happen or what would your options be to become eligible. So that is something that's kind of important, I think, for everyone to come away with if they just having a sense of those kind of different pieces. And if your current eligibility is only time limited, right? For some folks that are other than the honorable discharges, or they may be limited to certain care if they're 0% service connected and otherwise would be ineligible for care. A good way to be able to become eligible is to become service connected. So that's very important to know as well. And I think from there, we'll probably go on to the next slide. Thanks, Michael. One caveat as we're kind of transitioning, it's also good to know in the Bay Area, Swords to Plowshares is also one of the organizations that is able to help with character of service and discharge upgrades. So that would be another kind of good service to know about as well. So on to the next slide here, kind of why should I enroll? Oh, sorry, back one slide. I did add this meme because, it's good to have health insurance. If you don't have healthcare, even if you're healthy and you feel like you don't need it, emergencies happen, right? This meme that says, oh gosh, I had to go to the hospital without health insurance and I had a $20,000 bill. Like, where am I going to get that? Unfortunately, oftentimes it's much more than that. Healthcare costs are quite expensive when you don't have health insurance. And so you want to make sure you have VA healthcare. There's no enrollment charge. There's no monthly charge or annual charge to be able to get enrolled. And it's pretty low fee or even free for some folks, depending on service connection status and other eligibility status. But the copays are also pretty reasonable. So for example, medication is $5, $8, or $11 for a 30-day supply. Office visits are $15 or $50 for outpatient visits. And if you have all of your appointments in the same day, if you're able to lump them, you would only get charged for one. And once you're enrolled in VA healthcare, you're enrolled for life. So this is really one of the reasons why I really encourage student veterans in particular to enroll, and especially folks right out of the military, because even if your income goes up later, you're grandfathered in. So once you're enrolled in VA healthcare, you do have it for life. And it also covers you, even if you have a good job with health benefits. Let's say you change jobs, lose jobs, you want to be able to have some flexibility to be able to have kind of a backup health insurance option as well. You can also get a VA ID card. It's also, you have national-wide healthcare as well, as we were talking about before, and access to telehealth. Next slide, please. Thanks so much. And one of the things that I like to kind of talk about as well is, it's really, this is in some ways when you think about the VA, there I think can be particular conceptions and ideas about preconceptions about the VA. And I like to sometimes say, it's not your father's, your grandfather's, your mother's, your grandmother's VA in a lot of ways. There's a lot of access to whole health services. That's kind of the wave of the future, really looking at things like acupuncture, biofeedback, a kind of a list of things that are listed here, massage therapy, meditation. And I also love to plug Dennis Moore on our student veteran health program team with San Francisco VA, his Pause for Purple Hearts group, which is a wonderful group to be able to help train service animals to be able to help other vets as well. So there's a lot of great services out there at your local VAs, and sometimes the only way to know about them is to get connected and find out more. And next slide, please. Thanks so much. And as far as what does, healthcare include? So it's pretty comprehensive, right? It's pretty much head to toe coverage, primary care, preventive care, mental health, a lot of specialties kind of listed there as well. When I was talking about the a la carte services that you can receive specifically at the San Francisco VA without a primary care referral, we're talking about optometry, audiology, nutrition, and podiatry. So those don't require referrals directly. If you're enrolled in the San Francisco VA, you can go directly for those services. And the inpatient, outpatient surgery, emergency care 24/7. I had also mentioned the medications earlier. The one thing is you do have to be 100% service connected in order to receive VA dental within the VA at the medical centers. But we do also, for folks that are enrolled in VA healthcare, have access to the VA dental insurance program as well. And then, of course, we refer to services in the community for care that is actually not offered, for example, maternity care as well. And next slide, please. Great. So take home message, I would always kind of say when it comes to really not even just navigating VA healthcare, but really any VA benefits and kind of any benefits that probably in general, is it the importance of being persistent. There's some great benefits out there. It can take some time and effort, but it oftentimes is worth it. And we're always happy in our program to help break it down, help folks kind of that want to reach out for assistance as well. It's also really important to be your own advocate. So this kind of idea, when life closes a door, just open it again. It's okay. They're supposed to do that. That's how doors work. One of the pros and cons of it having a national VA healthcare system is that it is a bit of a larger bureaucracy and it can take some time and effort to navigate, but it is also nice that you're enrolling in a national healthcare system as well. So there's kind of pieces to that. And again, we're always happy to help with the navigating. Next slide, please. Great, thank you. So there's a picture of Dennis and myself at an outreach event. And so we like to say that our student veteran health program here in San Francisco, and I've been here since 2010 at our City College flagship site, really inspired the National Vital Program. So we're one of a number of vital sites across the country. And it's a program that helps veterans get connected with healthcare and receive a number of kind of services, getting connected for services, some mental health services as well. So we like to try and do some training such as these. Next slide, please. Wonderful, thank you. So just some examples, I'll kind of fly through these, but things we can assist with, VA ID cards. If there's any folks here at City College today, we're happy to snap your photo and be able to get you a VA ID card. We help folks figure out if they're eligible for VA healthcare, how you might become eligible in that enrollment process, also scheduling appointments. And we really like to have ease the experience of asking for and receiving help through the VA as well. And we do presentations such as these and referrals to oftentimes CVSO and other community resources that are really beneficial for veterans as well. Next slide, please. Great. So as far as how to enroll, this is just kind of a snapshot. If it's helpful to kind of have this, the form that you would fill out is usually the 1010 Easy. You submit it along with a copy of your DD 214. As far as how you might be able to do that today, you are welcome to check in with us after this presentation. We'll be here probably from about 1 to 5. At Skyline, I will be there next on Thursday, the 16th from 11 to 3. Those are my next in-person drop-in hours over at Skyline College, and also by request. So I have my contact information here if you would like to set up a time, and or my colleague Dennis, who's in the VRC right now at City College, is also happy to help as well. You can also apply online by phone and in person. I would probably encourage, if you can make it in person, to double check things. Always a good thing to do, because sometimes there can be holdups and you might not necessarily know that unless you're confirming that with a person live. So we kind of tend to recommend that if possible. All right, next slide. Great. And so this is pretty much, I think, our pretty much our final slide. So one of the things that we like to go over is just some general myth busting, which is really helpful, I think, because we hear these so often, these misconceptions. So first myth, VA healthcare is only eligible to veterans who have served in combat or have a service-related injury or disability. The fact is that you do not have to have a disability or have served in combat in order to be eligible for VA healthcare. So that is one kind of common myth that we like to bust. Another one is that veterans are only eligible for VA healthcare for a limited time, and that is also not true. Once you're enrolled in VA healthcare, you have it for life, but you do need to enroll in order to use the benefits. And you want to make sure that you do have healthcare. So that's really important. If you're a student recently separating from active duty, better apply sooner while your income is lower if possible. Another kind of myth, I can't reapply because I've already been told that I don't qualify due to income or insufficient active duty time. And that is also not true. You can always reapply if your circumstances have changed. So for example, your income has changed, you've become service connected, you've moved, so you're in a different geographic threshold area. Your family has expanded, you can always reapply. And also the income usually resets every year. So in 2024, we're looking at 2023's income, but let's say your income drops in 2024 and 2025, we'd be looking at 2024's income. One other myth that I think is really important to point out is what we hear so often, well, if I use VA healthcare, I'm going to be taking away services from a veteran who needs them more than I do. And in fact, it's actually quite the opposite, right? The way that VA healthcare works, not only is it a benefit that you've earned through your service, but when you enroll and use VA healthcare, it actually lets Congress know that this is a service is important, right? And helps ensure that the VA's budget is expanded to really ensure that it's sufficiently funded and that they're allocating enough providers to the care of all the veterans who need care. So really it's you being of service to yourself and your fellow veterans by enrolling and using VA healthcare. The one caveat I would say is that if you do make a VA appointment and you can't make it, definitely if you can call to cancel so that that appointment can go to other veterans, that would be great, because that is one of the things that contributes to long wait times if folks do not show for their appointments. So that would be the kind of that last piece. And then our final slide has my contact information as well as information for the Veterans Crisis Line, our San Francisco VA 24/7 advice nurse, and our San Francisco VA same day clinic information as well. And thank you so much, Michael.
Right. Thank you, Bridget. It's always a great time having you on. The information that you provide is very, very in depth. And with that, I do want to let you guys know that this presentation is being recorded. And we will also put a copy of the slides into the chat for you to download yourself so that you can have these resources with you, have the contact information with you at all times. Thanks again, Bridget, for being here. We're going to go ahead and pass it on now to Ed Kirikson. He is the County Veteran Service Officer at the San Mateo County Veteran Service Office. And he's going to talk to you a little bit about how to get in touch with your benefits and a little bit about service-connected disability. So, Ed, when you're ready, go ahead.
Hey, thanks. So, hi, my name is Ed Kirikson. I'm the County Veteran Service Officer for the County of San Mateo. Just a quick note, in California, each county is actually required to have or appoint a veteran service officer. So I'm just one of several different veteran service officers throughout the state, but we all operate under the same auspices. And so I'm just going to share some general information that would essentially apply at any of the veteran service offices that you go to. So, all right, let's go ahead and begin. All right, so you heard a little bit about what VSOs do. I like to, the more I've been doing this, the more I try to kind of put some context to what we do in a way that I think can be appreciated by the folks that we're serving, like yourselves. So we help veterans with, accessing VA benefits. Okay, so the Veterans Benefits Administration. Now, here's a key thing: is anybody can apply for benefits, right? You can apply you can file a disability claim on your own. You can go to va.gov and actually file your own claim. There's other organizations that are out there that can assist you. There are, unfortunately, claim sharks, which are organizations that will charge you to help you do this. But veteran service officers are a little bit unique in that we are county employees. So we're not part of the VA, but we are county employees. We operate under accreditation of the California Department of Veterans Affairs, which means that we essentially are agents, or seen as agents by the Veterans Administration. We have to go through an entire process to get accredited, which includes background checks, academies that we have to, successfully complete. We have to actually test to receive our accreditation, etc. And our job is to actually act as guides to help veterans and their dependents get the information they need, the assistance they need, the counsel they need, and actually represent you or represent the veteran on behalf of their claim. So we can file those claims for you. Most importantly, because we're accredited, we actually have access to your VA files. And because we're county employees, we do this for free. And because we're county employees, I like to also say we're the advocate for the veteran. So we're there to help you navigate what can be a very complex system. So to give you an example of some of the work we do in 2022, county veteran service officers, brought in approximately $425 million in new annualized federal benefits for California veterans. And that number has gone up substantially in 2023, and we see it continue to go up in 2024, thanks in great part to some of the new legislation that's been coming out, such as the PACT Act. So next slide. Okay, so here's some examples of just of the services that we can provide information on and help you access compensation benefits counseling or comprehensive benefits counseling, particularly on disability claims. We network with and advocate on your behalf with federal, state, and local agencies. DIC, which is a big program that supports the dependents of veterans who unfortunately have passed away either as a result of their services or 100% disabled when they passed away. Understanding and accessing burial benefits. And again, this is an area where a lot of people are very familiar, but there are a tremendous number of benefits that the VA has available for veterans and their families when it comes to burials. If you just want to find out about it, again, we're here to help. And if you have a situation where you may want to access them, again, we can help you do that. Claims and compensation, probably the biggest thing we help veterans with is filing disability claims. Pension and life insurance. Now, pension is a program that the VA has that can help really, low-income indigent veterans who served during wartime. We help file those claims all the time. Records requests, we can guide you through the process of asking for your service treatment records, your service records, your DD-214, you name it, right? Discharge upgrades, we can assist you with that, which is honestly sometimes a somewhat complicated process. College fee waiver, for those of you that are not familiar with it, if you're a service-connected veteran in the state of California, the California Department of Veterans Affairs offers a college fee waiver for your dependents, where your dependents can go to any California State College and the tuition is waived. It's an outstanding program. We actually waived over $1 million in tuition for San Mateo County veterans alone last year. And veterans designation. So veterans designation can be the veterans ID designator on your driver's license, all the way to license plate identifiers, and even disabled veterans license plates. We assist with the process for verifying and applying for those. Next slide. Okay, so again, I mentioned that service-connected disability is the #1 claim that we file. #1 reason that people come to our office. And we have folks that come to our office going. I've filed claims for World War II veterans. I've filed claims for Operation Iraqi Freedom. You name it. Everybody in between. So what is a service-connected disability? So a service-connected disability is essentially any condition, injury, or disease that was caused by or aggravated or first diagnosed during military service, right? As long as it is chronic in nature, meaning that you have to have a current disability. So if you broke your leg in service and today you don't have any disability about it, disability is a result of it. You're not going to get compensated because you broke your leg in service. But if that broken leg or that tweaked shoulder or the experiences that you had are having a residual effect on you now, then you do have a chronic disability, and that's what's required. Service-connected disability is for existing chronic disabilities. So, and that could be anything from, a missing limb to mental health issues to toxic exposure resulting in diseases. It runs the whole gamut. So, next slide. So, how do we do it? Next slide. Okay. So, what you're going to need essentially to file a disability claim is, again, a current disability. It is going to have been caused by or aggravated by, or if there was an exposure that occurred during military service. Okay. And most importantly, what we're going to need to do is link the two together in order to file claims. So the first thing I would do is walk through what it is that you want to talk about filing a claim for. All right. Based on what you share with me, we'll begin the process of developing that claim, gathering that evidence. So questions like, is it in your service record? Is it not in your service record, right? Do you have a current diagnosis? Do you not have a current diagnosis? All these questions will be asked, and based on the responses, we're gonna go ahead and create a game plan to develop a claim that we're gonna submit on your behalf. Okay. Once we have completed that process, once we've collected all the information that we need in order to, again, establish that you do have a disability, that there is some linkage to service, right? We're going to file that claim. And what's going to happen next is the VA will then begin developing that claim. And a part of that development is that at some point you're asked to attend what's called a compensation and pension exam, a CMP exam. And essentially, this is an exam where the VA is going to actually bring you in to discuss, verify the current disability, and most importantly, begin to determine the degree to which that disability is impacting you and your life. Because once you're service connected for an issue, the severity of that issue then is used to gauge the degree or percentage of service connected disability, how much you're going to get compensated for. And then once all that's done, we wait for a decision. Now, again, I mentioned that being accredited through the Veterans Administration, we also have access to your VA files. So one of the things we also do for veterans is we are actively in the VA system looking at where your claim's at, what stage it's being processed in, etc. So we also help veterans kind of keep a track on where their claim is at. And then once it's adjudicated, once a decision has been made, we then also work with the veteran to determine if we agree with the decision, if we agree with the degree of disability that's been assigned, et cetera. So our job is to really guide the veteran and be a set of eyes into the VA system for a veteran that they might not otherwise, have if they were to file a claim on their own. Next, and I should mention something right now. With the implementation of the PACT Act and just a few years before that, the Blue Water Navy Act and several changes that VA made in order to expand eligibility criteria for a lot of disabilities, some of these claims are taking a while. So if you see at the top it says intent to file, one of the first things I do with every veteran that I sit down and talk with is explain what we do, have a conversation about what they want to do, and then we file an intent to file. What an intent to file is essentially it's a form that we'll complete, we will submit to the VA, which notifies the VA that we intend to file a claim. Okay. It gives us a year from the date we file that intent to submit a claim to the VA. And what it will do is it'll capture the date that we submitted the intent to file as the date that your claim was filed. So when everything is said and done, once the compensation and pension exam's done, once they finally adjudicate the claim, which could be 6 months later, 4 months later, a year and a half later, depending on the complexity of your claim. If you're awarded disability compensation, it will be paid back to the day that we filed the intent to file. Okay, next slide. All right, so discharge upgrades, the first thing I would suggest is this. There are two websites located here, okay? Discharge upgrades can be complicated. These two websites will help you understand what is possible in the discharge upgrade and do a quick self-assessment to determine if you might be eligible for an upgrade, okay? One of the myths that I want to dispel is that if you get out of the service and you're just a really good person and you keep your nose clean for 20 years, that you can automatically get a discharge upgrade. It doesn't work like that, okay? There are many more factors involved in it. So if you are someone who might have bad paper, or someone who has a discharge rating that you don't agree with, that you wish to improve, the first place I would start would be by going to these two websites and doing the self-assessment to kind of get an understanding of what the next steps are and where you may stand in terms of your eligibility or ability to get a discharge upgrade. If we're going to pursue a discharge upgrade, again, depending on the severity, the complexity, etc., we would be gathering military records, medical records, buddy statements, testaments of achievements since service, to help essentially create a case to show that the discharge that you were given is not appropriate and that it should be changed. If you live in the San Francisco area, Swords to Plowshares is an organization that focuses especially on this. So they have attorneys on staff that are well vetted in the process for discharge upgrades. Oftentimes we will work hand in hand. And the example I'll give you, I've worked with veterans who have multiple deployments, right? And unfortunately, these veterans were not given the level of sort of attention that they might have needed to be given after their preliminary deployment, right? Really assessed for the impact that it had on them. Hence, they go perhaps undiagnosed and untreated for some issues that they may be carrying from that first deployment. And the next thing you know, they're going on a second deployment or a third deployment. Or they come back, and again, being undiagnosed, untreated, may go down certain paths, self-medication, you name it. Find themselves in a situation where they're going to get booted out of the military for something they did, right? And then, of course, be given the commiserate discharge. Well, our job in such a case begins with having to really explain that the military dropped the ball because they put this veteran in the situation and then didn't give them the proper support to be successful afterwards, but instead neglected them, allowing them to go on this path which led them to where they're at. Hence, it's really not their fault. So that, I hope you see that as just sort of a really simple example of how complex it can be. And again, I would start by taking the assessment, and then if you have any questions, reaching out to us. Next slide. So how do you find your CDSOs? Now, it's actually pretty easy. So obviously, if you go to California Department of Veterans Affairs, Calvet website, they're going to have a search function. You have your advocacy and assistant portion of the handbook where you can actually look up the directory of VSOs. Or if you go to the California Association of County Veteran Service Officers, CACVSO.org, there's a full list of all California VSOs. And then in addition to that, if you go to the Calvet website, not only will they have a list, but there's a phone number that you can call, and you just put in your zip code, and they will direct you directly to the local VSO. All right. Next slide, please. All right, and this is the lookup that's actually on the page itself. All right. And if you're in San Mateo County and you have any questions about any of the services that we provide that we can assist with, you're welcome to call us Our office is at 550 Quarry Road, San Carlos. Our office phone number 650-802-6598. We actually have a website also, and here's the long version, but I'll give you, if you just look up smcveterans.org, you'll find our website. And we have all the information there along with how to contact us. Give us a call if it's really hard to walk into the office, because a lot of times we can start this over the phone and kind of make it easier for you. Again, we're county staff. We're here to serve you. We don't charge a penny. And we've got, I don't know how many decades of experience in our office doing this. So if we can help you out, we're ready and waiting. Okay. All right.
Right.
That's it. Thank you.
Yeah, thanks, Ed. Appreciate you being on today. Yeah, I was circling that phone number because I think that's actually the phone number that's on the website you were talking about. So it's a CVSO web phone number that helps you find the closest one to you. But great information. If anything, these are the people that you're going to start off with for all benefits when it comes to federal and state. So definitely take this information if you're in the San Mateo County. If not, give us a call. We could definitely help you find the closest office to you. So I'm going to go ahead and move on. We're going to close it out with just a quick overview of what CalTAP is. So I want to appreciate you guys all being here today. I want to thank Skyline College, City College of San Francisco, and the Student Veterans Health Program for allowing us to speak to you guys today and bring this program to you. What we do here in CalTAP is we are designed to inform and connect veterans of all eras to their earned state and federal benefits, as well as provide continuous assistance and support as their needs change over time. So we are a transition assistance program that basically has gathered all the information and services that are available to veterans through the federal VA and the state of California. And we put them into pathways that make it easier for you as a California veteran to navigate. So we have a core curriculum pathway, we have an education pathway, there's an employment pathway and an entrepreneurship pathway. And then we have a service provider pathway. So that service provider pathway is for anybody who, is not familiar with military culture or maybe does want to work with the military community, just kind of fills you in on, what to expect when working with this population. At CalTAP, we want to be there every step of the way of your transition into civilian life. And if anything, we want to be there as you join, when you join into the military and as you're serving. This life cycle map that we have here is kind of what we're following when it comes to the areas that we try to be a part of as you're transitioning and aging and preparing for end of life. This Veterans Resource Book is also something that is provided to our California veterans through Calvet. I like to say that this book is like gold for veterans. So everything that we discussed today when it comes to the benefits and services, how to get them started, paperwork that's involved with them, eligibility requirements, all that stuff can be found here in this book. We are going to be putting a PDF copy of this book into the chat so that you can download it and keep it with you at all times. If you did want a hard copy of this book, you can always go to your county veteran service office or your Veterans Resource Center on campus. If they don't have books, then we can definitely ship some books out to them. This is what our website looks like. So if you do want to check out some of that curriculum that I talked about earlier when it comes to entrepreneurship, education, employment, you can go to calvet.ca.gov. Right there in the middle of the screen is that CalTAP banner. Click on that CalTAP banner. That will take you to our pathways along with modules that talk about some of the different benefits, services, and other resources that you can use at any point of your life. On this web page, you can also find the CVSO locator, which Ed talked about a little bit ago. You put your zip code in, and it finds the closest CVSOs to you based off your zip. And then at the bottom of the screen in the publication section, you can find another copy of the PDF Veterans Resource Book. So, if you do have a friend that's a veteran, or somebody that, you're working with that does want to know a little bit more about what's out there for them, you can always direct them to our website to download that PDF for themselves. All right, so before we move on, I just want to touch on a little bit about those California benefits. If you have any questions about these benefits, you can always reach out to myself or my colleague Jana, who's on the background right now. She's helping out with the questions and putting those resources into the chat. But Ed talked a little bit about the college tuition fee waiver. This is a fee waiver for child dependents. It's the only education benefit that CalVet offers. There's 4 different plans out there, but more veterans do fall into what's called Plan B. So as long as that veteran has a disability rating between 0 and 100, and the child's income level is below, I believe it's going to be below the state poverty line starting in the fall, then they can go to any state-funded school for free. So any CSU, UC, or California Community College. And also talked about that veterans designation on your driver's license. That just makes it so you don't have to carry around a DD form 214 in the back of your pocket anymore. That has very sensitive information like your social security number on it. We don't want that getting lost. Other programs out there like motor vehicle registration fee waiver. There's a fishing and hunting license that's offered at a reduced cost. A state park pass that's offered at no cost. These benefits do require disability ratings. I believe 50 to 100% for those 3. And then there's the different divisions that we have at CalVet. So if you think of CalVet as an umbrella, the different divisions fall underneath that umbrella. We have a home loans division that's different than the federal VA home loans. We have a women and minority veterans resources division. These divisions offer advocacy, outreach, and support for those populations. And then we have our homes for long-term care for veterans. And then we also have 3 different state cemeteries. So these are just some of the things that California does have to offer to our California veterans. And if you have any questions about any of these or want to know a little bit more about them, feel free to reach out to myself, your VRC, or your CVSO. If you want to keep in contact with CalTAP and want to know a little bit more about the webinars that we put on, or the live events that we are going to be a part of, you can always provide your non-DOD email address to that CalTAP inbox. We're going to put you on a mailing list, and you'll get a monthly email that talks about the different webinars and events that we'll be taking part of for the month. You can always register at My CalVet as well. That just kind of tailors the information on our website to what you're interested in more. And then you can check out our social media pages. I did mention that this webinar is being recorded. All of our webinars are put onto our YouTube page, as well as our archive section on our website. So if you want to go back and check out some of the other webinars we put up in the past, we've talked about everything from mental health, financial literacy, claims and compensation. We've done a couple of these webinars as well. So feel free to jump on those webinars, grab those resources, contact information as well. And if you need any help, you can always reach out to us. And then at the end of this webinar, I will have a QR code for the survey. Survey is going to be there for us. It's going to help us make this program better for you guys. It's going to let us know what we did well today, what we could work on in the future. If there's anything else that you want to know more about, also that will be the place where you can put that information down. So I want to thank you guys again for being here. This is my contact information. If you have any questions about any of the benefits that I talked about, the CalTAP program, if you need to get connected to somebody in your county veteran service office, or even somebody like Bridget in your area, feel free to reach out, and I could definitely help you out with that. I'm going to pass it on now to our last presenter. Kevin is the local interagency network coordinator for the Bay Area region. And he's going to talk to you a little bit about how our links help out veterans across the state. So Kevin, when you're ready, go ahead.
Hey, how's everybody doing? So one of the advantages of going last is that most of your presentation has been covered by other people. And one of the disadvantages is most of your information has been covered by other people. So I'll go through these slides really really quickly. If I can get the first slide, please. So we're basically outreach for the state. We're the boots on the ground in the territories in which you guys live, whether it be here in the Bay Area or all the way across the state. We have 8 different regions that we cover with 8 different people. So it's a large task, but yet we're available to help you and guide you to these resources that you've heard about. At the end of this slide, you'll get my cell phone number and my email address. So if you have any challenges in reaching out and finding some of the resources you've heard about, feel free to contact me. We want to make sure you're covered across the board. You've heard from everybody here that wants to help you and that's available for you. So as you can see, the light green region in the middle is my region, the Bay Area. I have 10 counties that I'm responsible for. And then my colleagues cover the rest of the state. We are familiar with the resources and benefits that are unique to our areas. So if you happen to know a veteran that you're helping out that lives in San Diego, the best thing to do is contact the link in San Diego because he knows the benefits and resources that are available there as an example. Can I get the next slide? So here's what we do. We provide outreach. We go out in the field. We're at job fairs, employment fairs, stand downs, wherever we can be available. State fairs, big thing in Northern California. Our link up in the North Bay goes to, I don't know, 10 or 12 state fairs a year to reach out to veteran members and meet them where they are. We make referrals to established service provider networks. In other words, those people within the community that are providing maybe jobs or information or benefits to veterans, we try to get you connected with them. We assist with local emergencies during the fires, during civil unrest, during these other things where we happen to be, where there happens to be local assistance centers set up or disaster relief centers, depending if it's federal or state. We'll be there to make sure that the veterans that may have lost something, whether their house is burned, they've lost their DD-214, their awards, whatever, we help them get back what they need. Sometimes it happens so fast, like back in Santa Rosa 3 or 4 years ago, 5 years ago now, they couldn't get out of the house with their meds. And so we helped immediately find pharmacies that were willing to work directly with the VA and get those replaced very quickly. And then we advocate on your behalf with our local leadership. We want to make sure that those people that are in charge, the people that are running the region, the ones that have either at the political level or at the public level, I should say, or in the employment field, understand the benefits of working with and hiring and being associated with veterans. Next slide, please. For employment, we rely heavily on our EDD. They have dedicated employees that are actually can do nothing other than work for veterans. And so if you're having issues, and they do everything from helping you find a job to helping you with your resume, appearance, to finding employers that want to hire veterans. So it's a full service through the EDD. There's a lot of EDD offices in the Bay Area, 20 or so around the Bay Area. So find a local one there if you're having some employment challenges and see if they can't help you out. You've heard from from Ed, and he said the same thing I'm going to say, which is that every state, 56 out of 58 states in California have veteran service offices. 57 out of 58. It's mandated. It's law, and so they're the people that really understand and can certify your eligibility or help you understand what benefits and resources are coming to you, because they do it 24/7. I have a lot of different jobs, but I don't specifically file claims, and I would do you a disservice if I tried to file a claim on your behalf. So please understand how important our county veteran service officers are. You don't have to live in the county of where you go to a county veteran service office. You can live in San Diego and call to Humboldt. But so if you, for some reason, call one and you don't get the information you think you wanted, or, everybody has bad days, or it just you didn't connect like you thought you wanted to, or didn't get a return phone call, you can try another one. Ed will take your calls. I'll send everybody to you, Ed. Ed will take your phone calls all the time. And then you heard about our CalVet benefits in depth from Michael. We help you to find those things. And then you heard from our healthcare system. We work very closely with our big brother, the big VA, we call them, which is our federal VA program. And you heard some great presentations with regards to exactly how you can navigate that system. But we're here to help you if you can't. If you can't get a hold of somebody else you heard on the thing, call me. Next slide, please. And there I am. So there is my cell phone number, my dedicated email address, and my name. Take a quick shot of that with your phone and contact me if you can't get a hold of anybody else, and we'll get you whatever you need to get done. And I thank you very much for being here today. Thanks all the presenters. Good to see you guys again. And I'll turn it back over to Michael.
All right. Thanks, Kevin. Always a great time having you on as well. Links. The links are a great resource all across the state. So if you had a chance to take a picture of that link map, please use it if you're not in the Bay Area. And like I said, also, this presentation is in the chat as well. So if you want to download these slides to have that contact information with you, go ahead and do that right now. We're going to go ahead and move on to the questions and answers. I'm going to bring Jana in. I do think she was taking care of the chat and the Q&A as we were going. But I just want to bring her in just to see if there's anything more that she wants to say. If not, we will go ahead and close it out because we are right on time. So go ahead, Jana.
Yeah, you know, there were just a couple questions about the college tuition fee waiver. So feel free to email us directly if you guys have more questions. I know I'm going to directly contact one of the participants right after this. And then definitely contact Bridget with any healthcare related questions, because that's what she's here for. So I will turn things back over to you, Michael.
Great. All right. Yeah. So for this slide right here, I'm sorry, go ahead.
Oh, so sorry. I was just going to say there was one slide we got live at our City College VRC. So just the question that came up, which may come up for other folks as well, was around whether or not folks, for purposes of taxes, have health insurance if they have VA healthcare. And you do. If you have VA healthcare, that covers you as far as that particular coverage, or kind of that criteria. So there's a specific form that's supposed to get mailed to folks. It's a 1095B form that I just received that from our member services person who is here today, Michelle Basuego. And so if you haven't received that form, you can always call HEC, which is the Health Eligibility Center for the VHA, to request that form to have it remailed to you. So I'll put that in the chat so that folks have that number as well. It was on our slides, but let's see here. For some reason, I can't enter it, but I will. The phone number for HEC is 1-877-2222-VETS. So that's 8387. So I'll put that in the chat now, but just wanted to be sure to answer that live question that came in.
Perfect. All right. Thank you, Bridget. Jen, I do see a couple questions did come through. Do you want to
Yeah, I'm grabbing those right now. I saw those. Okay. Are there any resources you guys can provide or refer to us when dealing with Social Security? Gosh, that's a really great question. And you know, that's one that I would probably have to look up. I'm not sure if Michael, if you know anything about Social Security, I'm not really sure. I think that's more on the federal side. I know Ed had to step out, so that might be a really great question for a county veteran service office, or if you wanted to email us directly at that CalTAP email, we can try to maybe talk with you more offline and maybe see how we can figure out that question. So sorry, I don't know much about Social Security.
Hey there, I'm actually here still.
Oh, I thought you said you had to step out. Sorry about that, Ed.
No worries. So it all depends on what you're trying to do with Social Security. So if it has anything to do with a disability claim, then yes, so sometimes we can assist you and kind of walk you through that process. But you know, feel free to call my office, and we can kind of go over in detail what it is and see if we can provide some assistance there.
Cool. All right. Other than that, I think we're good.
All righty, sweet. All right, well, let's go ahead and close it out. Again, I want to just talk to you a little quickly about the survey. Feel free to take a snap of that QR code if you want to fill this survey out. Again, this information sticks with CalTAP, just lets us know how we're doing. and lets us work with this program and make it better for you guys in the future. So I'll keep that up for a couple seconds. And then I want to tell you a little bit about what's coming up next. So that QR code right there is going to be for our Constant Contact registration page. These are some of the webinars we do have coming up in the month of May. We talked a little bit about discharge upgrades today. Next week, we will have a webinar that I will actually be taking part of with Citrus College. But if you want to know more about that, feel free to jump on our Constant Contact page and register that way. Okay, thank you guys again for being here. I want to thank Skyline, CCSF, SBHP, and San Mateo CVSO for being here and allowing and working with us to bring this presentation to your guys' student veterans. You guys have a good day.
Can you go back 2 slides really quick to the upcoming events? Just wanted to see if we can get, there we go. Perfect, guys. Thank you. Let me scan that really quick. So my phone, so that would make sure we share that out. Cool. Thanks, guys. Appreciate it.
Sweet. All right.
Sweated from City
All
College.
right.
What's up, Kevin? It's always good to see you, brother. Always good to see you, man.
Sweet.
All right.
All right.
Sounds good. Hey, Brian, thanks everybody for being here. It was great, great seeing everybody, and thank you
Yes,
for all
sir.
the veterans that are online.
All right. Take care, y'all. Bye.
All right. Sign out. We'll see you guys at the next one.